Welcome to the Fancy Comma YouTube. Today I'm joined by Beth Linas, PhD, MHS, who is an infectious disease epidemiologist whose career has focused on substance use disorder, harm reduction, and implementation science. After earning her PhD and MHS in epidemiology from the Johns Hopkins Bloomberg School of Public Health, she completed a AAAS Science and Technology Policy Fellowship, which brought her to Washington, D.C. Over the years, she has led complex multi-site research across academic, nonprofit, and government settings with a focus on translating data into policy-relevant insights. After 6 years working with the federal government, she was laid off from a federal contractor position in 2025 due to federal budget cuts. Currently navigating both IVF and a career transition, continues to ground her work in authenticity, advocacy, and a commitment to public health. Welcome, Beth. So you've built a career in public health and epidemiology over the past, going from your LinkedIn, it's been like 2 decades of working in public health, maybe more. What got you into this field and what kinds of things have you worked on over the years?
Thanks so much for having me. I'm really happy to be here. When I was in college, I thought I wanted to go to medical school like a lot of people. I took all the pre-med courses and I took the MCAT, and I am not a good standardized test taker. So took it twice and it was not good scores. I stumbled upon a class my senior year called Epidemiology and Biostatistics 101, so very basic. And when I took the class, I realized my interest had always been in people that have HIV and understanding what are called the social determinants of health. And that's what I was always interested in doing, whether I went to medical school or not. And when I took this epidemiology class, I learned and realized quickly that what I actually wanted to do was be an epidemiologist because I was more interested in population level outcomes rather than individual care in that sense, which is what medicine is. After college, I worked at the New York City Health Department to get some more experience under my belt. Before going back to grad school. While I was in graduate school, I was really focused on populations at risk for HIV. I ended up researching people who use drugs, understanding the environment in which people use drugs versus crave drugs. I also utilized sort of a digital health method of collecting data, which at the time was novel, which is not so novel anymore. I was really interested in, like I said, substance use disorder. I also did some research on men that have sex with men in the HIV space. Since being in grad school, I've actually, while I was in 2 different roles as a federal contractor, I've done a variety of different kinds of work, trying to focus on infectious disease, but not always. So I actually worked on a very large project with the Office of the Assistant Secretary for Health, or OASH, on evaluating a teen pregnancy prevention program. I also have worked at the NIH, with the NIH on a long COVID study called Recover. I also worked with the CDC on sort of a technical meeting around tularemia, which is another infectious disease. The biggest thing I've worked on since grad school would be the Healing Community Study, which is a large implementation science study, as well as a trial that's trying to reduce the rate of opioid overdose deaths by 4. The main paper was, I think, published almost a year ago. I worked on a sub-study called the Stay Safe Study, which was examining the use of fentanyl test strips among people who use drugs. We worked with 3 other states. I worked on creating the survey. I wrote manuscripts that wound down end of last year. And then actually, as I was sort of picking up new work, I got riffed.
So was your new work that you were going to do in that same realm?
I was going to be working with justice-involved populations and their risks for HIV.
So that was with, you said, CDC.
So what I just mentioned was going to be with the NIH. The CDC work was tularemia, and NIH, I worked on the Healing Community Study and Recover.
I've heard of Recover. Long COVID people were really sad that a lot of this long COVID research was basically shut down. Okay, so I'm trying to sort through everything you just said. So you're working at the NIH, you're working on...
I was working actually at RTI International, which is a federal contractor. And I was working, the work that was coming in that I was doing was on behalf and with the NIH.
And it was on the opioid epidemic. See, that's interesting to me because the opioid epidemic was a huge focus of the first Trump administration. How did you find out you were laid off from your public health position, and what were you working on, and what was that experience like?
I worked on the Healing Community Study mostly, and then I was going to be starting work on a study of justice involved individuals and their risk factors for HIV. The way I found out was pretty unceremonious. On a Monday, the leadership had said they're going to be taking staff action. They didn't say what staff action was. I wasn't smart enough to realize what that meant. It was a Monday, and then Tuesday they had another all hands at lunch saying that the staff action was going to be, they were going to be laying people off, and right after this call, there would be emails sent to 150 people in our division. It's like, if you get the email, you'll know, and you'll go forward from there. And about 15 minutes went by, and I got the email in my inbox.
So what did the email say?
Due to shifts in administrative and the goals of this administration and a reduction in, I think, contracts and grants at RTI, we are having to make reductions in staff to be able to meet our goals, essentially.
Was it everyone at RTI, or just a subset, just your group?
Just 150. The first round.
Oh,
the first round.
So do you know how many of your coworkers are still there at this point? Are there any?
RTI has since laid off 35% of its organization. Some of my friends are still there, and some of them are not.
You have some coworkers that are still there persevering?
I have a handful of coworkers that are there persevering.
Do you know what it's like for them right now? Have you talked to them?
Actually, I have. And for a while there, I think right now they're sort of slowed on their reductions. But in between the different reductions, folks had said that it felt like they were on edge. They were walking on eggshells. They didn't know if tomorrow they would be the ones that would be let go. They didn't know if tomorrow their work would still be funded by the federal government. But I think things have slowly started to sort of even out now, because I haven't really heard much.
I've read a lot of Reddit from federal workers. There's a whole Reddit about the federal workers, and a lot of people are having like really bad like problems every day. They're like, I wake up, I go to work, I don't know if I'm on the chopping block, I do my work, I'm still feeling like I could be fired any day. That sounds pretty hard. But I talked to another person that was working in NIH, and she was a science communicator, and she was laid off due to reductions in force. It was kind of decided by the Supreme Court, but she said there's still people working there. And I'm like, how is that possible? Mainstream science is definitely not a focus of the second Trump administration, where I think it was more of even in the first administration with Operation Warp Speed and everything.
I mean, I think the destruction of science is way more in their purview right now. That's what they want to be doing than sort of propping it up compared to last time.
The destruction of expertise
in our systems and our infrastructure, preventative, our healthcare task forces, our vaccine schedule.
It's alarming, because I was thinking about it, and I was like, it's already bad. We have 3 more years of this. Every day we'll wake up and we'll see more things that we really valued in our US federal science infrastructure have just been taken away. So I was like, well, I might as well be happy today, because it's just going to get worse tomorrow. That's my feeling. But then at the same time, there's another part of me that's like, we have to fight against this and preserve science and preserve public health. That's what I'm like trying to do, but with the understanding that it may all just crumble at some point. So, but you actually work in public health, so you have a much different perspective of this. Public health is definitely in question under this administration, especially with the selection of RFK Jr. as HHS secretary. I emailed both of my senators about this, and they still both voted yes on that. Senator, the guy from Louisiana, Senator Cassidy, do you remember how he was on the Senate floor? I was watching C-SPAN. He was like, I am going to work with RFK Jr. to make sure that he does not touch anything with the vaccine schedules. And I think it was yesterday, RFK Jr. just yanked away hundreds of millions of dollars for mRNA vaccines, because he said the mRNA vaccines do not protect against the different strains of a virus, and he said that the COVID vaccine didn't work. So you're in public health. What are we supposed to do in a time like this? Do you have any recommendations for combating the misinformation? If you can even tell it's misinformation, how are we supposed to know without scientists in HHS what we should do for our health?
Right now is a really good time to organize. I'm part of a group called Defend Public Health. You can look them up at defendpublichealth.org. It's 3,000 scientists and public health officials and people who support science, not necessarily scientists, working on sort of addressing all the things that keep coming out against public health, and working on letters to senators and congresspeople, and different sort of campaigns that we want to run, social media campaigns, for example. So I think a really good thing for your sanity and your mental health is to be with people around like-minded individuals, though that's sometimes how we end up in these situations. So I recognize that we have to definitely reach out to other people. And I think that's where science communication comes in. There's a lot of people who could be doing more communicating. It's really important to first to figure out if it's misinformation. I always look and see if they have evidence or anything cited. I try to see if the person that's writing is coming from a place of expertise or has a background in what they're talking about. I do question a lot of things people say. I think that it's good to be inherently, in this day and age, unfortunately, a little suspect and suspicious about some big claims, especially if claims are sort of red flag claims, like very basic, like this food's going to cure cancer, and there's no data to back it up, and there's no sort of research and literature to back it up. You asked about combating misinformation. It's very hard, but it's being patient and meeting people where they are and listening very carefully and not trying to debunk every single thing that they're saying. A good method that I've learned is sort of a truth sandwich, which is basically you start with a truth, you address a myth, and you end with a truth. So an example of that would be, COVID vaccines are safe and effective. Some people, might think that they impact fertility, make you infertile, but there's no data or evidence to suggest that the COVID vaccine impacts fertility. There have been several studies. And in fact, we have shown that it is a safe and effective vaccine. So trying really hard just to sort of keep things very basic and very fundamental when I'm also talking about science as well.
That's great advice, by the way. But another part of this is, remember all of those people in COVID that didn't want to do any public health things to the point where well, it breaks your mind to think of it, because Donald Trump was the guy that was like, hey, everyone, we can have COVID vaccines. I'm going to call the CEOs of like all these different companies and we're going to have a vaccine and it's going to be so great. It's going to be the best vaccine ever, because he always talks like that. He's always like, oh, this is going to be amazing, like never before. And then we did have that and it was amazing like never before. But then at the same time, I feel like there was an information vacuum, and I'm not sure whether that came from the administration or it came from all the legal problems with like writing about COVID vaccines. We just didn't have any information on how COVID vaccines were going to work, and we didn't really even know, were they going to work? I mean, we kind of did, because we had like 30 years, 40 years of research on mRNA, but I feel like no one knew about that.
That's where I think that's where we started, where things went wrong. We did a poor job of explaining that, yes, this is a new technology in this space of COVID, but it's not a new, technology in the space of vaccines. That there had been lots of research on mRNA vehicles.
We could have talked more about that, and I don't know why we didn't. Do you know why we didn't talk more about that back when it was really timely?
Honestly, I think it was sort of people got caught up in the notion that we were about to roll out this massive vaccine effort and how long it took to get there and what was happening. And I honestly think that no one really stopped to think about it. I would expect that some people thought that, like, why wouldn't you take a vaccine? We're in this pandemic. We were not able to do things of our daily lives that we want to be doing. This vaccine could allow us to do that. Why wouldn't you want to? But I think there was a miscalculation on the public health side of understanding people's reasons or hesitance for taking the vaccine.
It's just like, I feel like that's where this all started. RFK Jr. was just a lawyer that was related to RFK before this. And I think he was doing like environmental work at some point. And now his whole thing is vaccines. But I feel like when scientists talk about this, like there's so many talking points, like, yeah, vaccines are safe and effective. Yeah, sometimes it's very rare, but you could theoretically have an adverse reaction to vaccines, but there's a whole system for reporting them. And there's also, vaccines have already gone through clinical trials. But it's like, for some reason, that just doesn't stick in people's minds, because they think about it, they're like, I don't understand what this is doing. Remember when people were like, it's going to leave different mRNAs in my body or something, but RNA is very unstable. It breaks down very quickly. I wonder, like, how did we get here to the point where we started out with this public mistrust in vaccines, public skepticism in vaccines that never got addressed or something, or politicized. I don't know if you remember when the GOP judiciary, I often bring up this example, they tweeted, if vaccines work, why don't they work? Because they're talking about breakthrough cases and the fact that you could get your vaccine and still get COVID, but of course it would be a lot less bad.
Well, that's also a failure of communication. Vaccines aren't meant to sterilize. Some are, but these sort of viral respiratory illnesses that change and mutate all the time, we were never going to be able to prevent anyone from getting COVID. We were always trying to prevent someone from getting very sick and
So
needing to go to the
now,
hospital.
yeah, I mean, and I know that. Now I feel like our challenge as science communicators is not only remind everyone like, hey, public health is actually good. Like mainstream science is like, here's the scientific method, it really works. Now we also have to, like, because every day I wake up, I see Donald Trump, I see RFK, who is literally the head of HHS, but doesn't believe any mainstream science. I mean, there's some things. Like, I feel like I could have a whole conversation about, like, here's where I agree with RFK Jr., and here's where a lot of people also agree with me and RFK Jr. But, like, for the most part, there's so many stuff I don't agree with him, and that's why I wanted everyone I know to, like, call their senators, and there was this very loud, spirited debate on the Congress floor, and Mitch McConnell voted no against him, but here he is, HHS secretary for the next 3 years, possibly.
Yeah, I
So
mean, and just on its basic facts, like if you look at anything, he has no medical background or medical training. And so regardless of how you feel about anything else he feels about, for me, it's hard to take direction from someone that really doesn't have a leg to stand on.
that's really concerning for me. And I think that's where we talk about like organizing and why that's so important as scientists and people that support science. Because when I try to think about how I feel about this, it's hard to have the right words because I'm like part angry, part confused. Like, why does everyone suddenly not like science anymore? I mean, maybe it was because of COVID. Now I feel like the discussion on science is different. It's all about like, right now it's all about like food coloring and autism. I'm not like the hugest fan of like artificial stuff in my food and ultra processed foods. Like, fine. I thought it was cool that RFK Jr. was going to try to stand up to these big mega food manufacturers, some of which are kind of the second vestige of big tobacco. Tobacco is now like such a public health problem that they're now moving to ultra processed food to try to make their money back or whatever. As someone that has been laid off from the federal contractor workforce that has worked in public health, what are you planning to do for the next 3 years to get through this time? I mean, you said you organize. Is there anything else like that you would recommend we do?
I mean, I'm just doing as much science communication as I can. I'm on Blue Sky um, and Instagram, and I'm thinking about maybe getting on TikTok, but I might be too old. But sort of, and also when doing science communication, sort of meeting people where they are and make it a little more fun and light because I think it could get bogged down sometimes.
It definitely can. And when I think about the science communication we did in the pandemic, a lot of it was hard too, because remember, we were trying also in the pandemic, I didn't do anything but work for like 3 straight years. I barely exercised. I never went outside because there was a pandemic. I was like, I don't want to go to the grocery store and then get COVID. I'd rather not go to the grocery store. But some people were much braver than me, and some people were unfortunately not alive anymore because of everything that happened. So, like, just thinking about that time for me as a pandemic science communicator is so hard because I'm like, I'm here today. My whole business, even, is because I explained science during the pandemic. Like, I paid off my car recently. That's one thing I bought during the pandemic. A lot of people are not here today. And then I'm like really concerned for the future because what if measles is back? We had measles at our local mall the other day, and I was like, well, I don't have any money to go to the mall, so thank God. It's a conversation that didn't start in the pandemic, but it's part of a larger conversation about How do we communicate with the people that we're helping as public servants? Okay, so to sort of shift gears and talk about something else, you are currently looking for work as a laid off, fired, fed contractor, but you're also going through IVF as well, which is not only deeply personal and physically and emotional demanding, but also the subject of legislation. How do these two life events intersect for you in our current times?
It's not easy to have two very big life events going on at the same time, especially when one depends on the other. So, what I mean by that is my IVF sort of depends on my job because I get health insurance through my job. And right now, I'm paying for Cobra, which is extraordinarily expensive. And it's out of pocket, it's not coming out of a paycheck, right? So, if I think of it like that, it's very gets me down. What I have learned and what I've been able to do is I sort of focus on one, and if I need to focus on the other, I will. So a lot of the time, I'm trying to focus on finding a job because a lot of what IVF is sitting and waiting around. Certainly going to the appointments, yes, but there are definitely built-in waiting times you have to deal with. So I try really hard to sort of shift from one to the other if I need to. That might mean I'm shifting worry from one thing to the other, so that I'm just worrying, which isn't healthy, but definitely a challenge. I've said to a bunch of people that this is the hardest period of my life so far.
I'm sorry to hear that. I mean, honestly, that's something I would expect to hear from someone that is laid off from the federal public health workforce in our current times, because public health, public servants, that has two publics in it. Public health, public servants are really what we need back in our government. I just paid my taxes in March, and I was like, I don't agree with anything that's going on in this administration, but I'm going to pay my taxes anyway. I really wish that my tax dollars could go to the work that you're doing, because I know a lot of people personally affected by opioid addiction, and I think it's sad that they don't have that research going on for them anymore. That's the whole purpose of our federal government, is to have different programs and services and knowledge generation that helps the people that live here. And I feel like the government's kind of saying addiction isn't a problem by laying off you and the rest of your team. And we all know that that is very, very false.
And the NIH and the National Institute for Drug Abuse, NIDA, are still funding projects and things are going on. It's harder for sure because a lot of those projects also involve DEI, and we know that DEI funding was cut. It's tricky, but there is some funding. But I would agree that the opioid epidemic and sort of people who use drugs are not a focus or an interest of this administration this time around.
I really feel like they had this idea to just like lay off everyone, because like they don't need a scientist anymore, because now we have ChatGPT, and then just ask ChatGPT to do the work of scientists, which as a writer, I know that ChatGPT can do a lot of stuff. Like it can give you 100 words on like concrete floors, as I used to write, and get like $100 out of it, but it can't do your work. Do you think that the current HHS is like replacing contractors and federal workers with ChatGPT? Am I like just really cynical about this?
I think they're using AI or ChatGPT, but I don't think they're replacing whole people for it because there are still higher level skill sets and understanding. I don't know how well those translate into in AI, but I think they're certainly using it. But I mean, that's a little bit of a different conversation. I look at it as a tool. I do not look at it as something that I want to replace me or replace someone.
It's useful for certain things. I was asking it some questions last night, learning about the FDA approval of a new drug that I'm writing about. But then I tried to go to the FDA's website to read about that drug, which was recently approved, and I got a broken link. And I was like, where am I supposed to get my information now? So then I just went to the manufacturer's website, and they had a press release about it. And it was like, oh, this drug is so great. And like, usually the government websites are a little bit more objective. I personally don't trust biopharma companies' press releases to be an objective source of information for their drug. There's a lot, really, really a lot to unpack with what's going on in our current times. Definitely with public health times a million, there's a lot going on there. Maybe it's not productive to harp on that and really just emphasize the need for scientists to mobilize, because we're now here where science is like probably the most politicized of my whole life. What's next for you in these times?
What's next for me? So I really need a job. I really do, because I need to get on to health insurance. That's not the health insurance I'm on. But I also really need a job because I'm passionate and love public health and I want to get back to it. I know that it's probably going to be different. I also just want to be around colleagues and coworkers that all share sort of the same goal of working to enhance public health. And then hopefully maybe get pregnant. I don't know if I will. That would be an icing on the cake. And I think that's actually asking a lot. So I'm going to stick with that.
That is way ambitious than I could fathom to be in our current time. So I'll just wish you good luck with that. What kind of jobs are you looking for, by the way? Like, what's your skill set?
As an epidemiologist, you sort of know how to frame out and design studies and write protocols and collect data and analyze data. That's sort of the research end of being an epidemiologist. There's an applied side of being an epidemiologist as well. I like the applied work. Program evaluation, development, implementation science, actually, I think is a little bit applied. It's a little tricky because the competitors to my past company I would look at, but no one's hiring. They're all on hiring freeze. I don't have any desire to go into the federal government, which I would have previously. I would look in the federal government, no problem. And so I'm really looking at sort of foundational work. And I'm also looking at trying to break into the pharmaceutical industry, but it's very difficult. I'm looking in the pharmaceutical industry, I'm looking sort of at these medical science liaison roles, medical fair type things. And otherwise, any sort of research adjacent role.
Are you focused specifically on opioids, or are you trained in other public health things?
I'm broadly trained in infectious disease epidemiology. So that means I can do several things, vaccine related, any sort of virus, any sort of infection, really. I am not only looking in the opioid space, there is not enough opportunity there. So I'm trying to keep my topic area broad, but my skill set is definitely of an epidemiologist.
I feel sad now that you've been fired because, well, I mean, honestly, like, I don't know what government contractors do. I don't even know what the people working in the government do. But like, you sound like such a talented person. You're the third person that I've talked to that's been affected by the funding cuts recently. All of you sound really talented, so it's very sad. I mean, that's going to be an issue in the next election. Why did you fire all these experts in science from the places that were supposed to be helping us with science? I'll vote for anyone that trusts the science in the next election. So you are going through a lot right now. Maybe I can ask this question. What keeps you going right now at a time where everything is just crazy?
What really keeps me going is reminding myself that this will not be forever. It's actually very similar to how I got through the pandemic, that this is not going to be forever. I mean, I'm not going to allow it to be that way. So that's sort of the way my big picture thinking. On the day to day, I would say it depends when you catch me. Sometimes I'm positive, like right now, and sometimes I'm feeling like, oh my God, how can I do this again? And also just knowing, like, very kind of you to say that I do have value and I have something to give, and it's good to be reminded of that so that you can remember and then, bring it out when you go looking for jobs.
Well, I wish you good luck in finding a job and having your baby. And I'm sorry you're on Cobra. I've been on Cobra, and that is incredibly, incredibly expensive. Yeah, sorry
Also,
to you, especially without a job.
Just a fun fact, just so you know, I have unemployment. Everyone's like, do you have unemployment? Yes, I do. DC has unemployment. It is $378 a week.
$378 a week that's not enough to pay my bills, and I live in a low cost of living place.
Yeah, no.
That's not enough for Cobra either. But it's nice to have. I'm not saying
it's super nice. I mean, all that money goes towards my health insurance. I'm more pointing out that when people are like, oh, but you have unemployment, and when people say that, like, people mess around when they're on unemployment, they don't want to get a job. They're not incentivized. It's really, truly not a livable wage.
There's a lot of, especially with our economy, the way it is, like Donald Trump, the Trump administration just looked at the jobs numbers and fired the head of the Bureau of Labor Statistics. I feel like maybe it's Donald Trump, maybe he's in denial. Like, sometimes, when you look at some data, you're like, what? This isn't real.
It is real. He just doesn't want to believe it. So he says it's not. Something to remember also about the administration. And also, when you read anything online, just because you say it doesn't mean it's true. And there's a lot of instances of that.
I've heard so much misinformation these days that you can't debunk it as fast as it's coming out. A lot of it's coming out from the government. The role of government in my life has changed so much just in the past 7 or 8 months. It definitely gives you a lot to think about. I'm not unemployed, but I definitely am really focused on staying positive in this current time. Political times always change. They're one way, they're the other way. Usually through all of it, science has been like part of decision making, but it's evident now that they're trying to get rid of the scientists for political reasons. But that's how politics is. Like it's always like this on some level. But it's important for people, especially scientists, to be like very engaged in this discussion because this isn't one of those things that will just go away overnight. If anything, every day we should expect to wake up and see more and more executive orders. There was a new report released by the Government Accountability Office of Congress that said that the Trump administration may have overreached by getting rid of the grants that Congress
Yeah.
appropriated. So there's a lot more of that too. I'm planning to follow the news more when I can. Sometimes I just don't. Sometimes I just work on my own stuff and I'm like, I don't have to listen to the news. I'm just going to do me and see what happens and like see where I'm at in like month, 2 month, a year, stuff like that. I really am trying to stay more balanced and have better mental health as a scientist. I think it's very hard for scientists right now, but I think that taking care of ourselves and also organizing really helps my mental health as well. And it's worked too, because the National Weather Service is now hiring back some people. So that gives me hope. People are starting to notice. Non-scientists are definitely very engaged in this fight for science. So that also gives me a lot of hope as well. So anyway, thank you for taking the time to talk to me. We'll have to persevere and see where we are sometime from now, maybe even a year from now. Things might be completely different. You never know. That's
Yep,
how
that's
politics
true.
is. So
I really appreciate being here.
thank you for taking the time. And yeah,